My name is Megan Coffman, and I'm one of the anesthesiologists, the employed anesthesiologists at IAA.
What led you to join IAA?
I joined IAA because it was a great team of anesthesiologists. When I interviewed here, everybody was super nice, super friendly. You could tell they worked just like as a great team together and really kind of cared about all the people in the group and wanting to make sure that they, while of course doing the best for patients and providing the best anesthesia, were also sort of making the best situation for all of the staff. Everybody seemed super happy and just really enjoyed working here. So it was a great feel from the moment I met everybody.
Have you worked at other anesthesiology practices?
I have, yeah. After finishing my residency, I was at Brigham and Women's Hospital. I worked at a really excellent practice down in Virginia, Fairfax Hospital in Virginia, with a great group of people, and then moved to an academic practice, which was also very wonderful at Albany Medical Center. So I had this great, like, high acuity, high volume, level 1 trauma experience, and then moved to, in private practice, moved to an academic center, which was a similar type setting, also wonderful people, and moved to, after that, for my family, to this Connecticut area, and worked at Stanford Hospital for a little while in a small MD-only practice, which was also a great experience. But then wanted to get back to something that was a little bit bigger, a little bit more academic, but not completely academic. And really, this group has been like the perfect combination of all the things I've liked about all the 3 practices I've worked at in the past. And it's really been my favorite so far, actually. And I'm just very, very lucky to have wound up here. In part because I've been able to really learn a lot of regional anesthesia, which I hadn't had the opportunity in some of these other practices.
Do you have the opportunity to practice regional anesthesia?
So I practiced initially in a group that didn't do a whole lot of regional anesthesia. So I hadn't, it hadn't been done quite as much when I was in training. It was just starting to become, you know, sort of like the bigger thing as I was finishing residency. And then the group that I worked at initially didn't do a whole lot, so there wasn't a lot of opportunity there. The second group that I worked at in Albany was a large academic group, and they had residents and they had regional trained anesthesiologists. So between them, they kind of did all of the block cases. And there was an opportunity here and there to kind of watch and see and pick up a couple things, but not in the way that was really helping me to learn and train and be able to do my own regional anesthesia. And then the group that I was at most recently was just a little bit too small to have the ability to get me out to do blocks, to learn things. And what's been really wonderful here has been that, well, they have just people who are so well trained and so knowledgeable and so good at teaching that when I came in with this interest that I hadn't been able to really to have experience with before, they kind of like got me up and running and just taught me, took me to cases, took me to blocks, and to the point where I now, you know, can practice solo doing all these cases. And I, you know, when I do need help, they are right there, and it's been a really great experience.
Can you describe the regional anesthesia training?
Well, it's been really nice because they have all, I mean, Teresa, Vlad, Rob, Julia, Emily, everybody who has such great training has been really able to kind of explain in detail, show me what they're doing to a point that then I would feel comfortable in turn explaining to somebody else. That, you know, and the other part is that because we're such a team and I'm so comfortable with them, any questions I'm you know, happy to ask them questions. I don't feel uncomfortable asking them anything. They give, you know, they're just very thorough and helpful and made sure that I'm comfortable always with what I'm doing too, which is the other thing. If I ever had the opportunity in the past, there wasn't necessarily that sort of backup in early stages, which you kind of need as you're just starting to learn.
What does a great team mean to you?
It means everything. It's really, everybody is so helpful that it makes you provide the best patient care. You know, you have people behind you, you have help with whatever you need, and the comfort and ease of saying, hey, I have a little bit of a question with this, like what do I do here, and not worrying that like, oh, this is something I should have known. You know, these are my friends, these are people who also support me and are truly the experts in the field. And when we're doing blocks that people who I know who are regional fellowship trained in other institutions are saying like, oh wow, you know, you guys are doing those, we haven't done those before, or that's new, like, you know, or I read a paper about that, or some of them were writing the first paper that exists. It's like, well, you'll see it coming out. And so it's very cool.
Do you think patients can tell when a team works well?
I think that they do, yeah. I think patients can tell, and I think, and when you see them afterwards, and the other, you know, amazing thing is that they've been so well taken care of, and we have kind of protocols set up. And so when we have this protocol in place for joints and for shoulders and for hips, knees, and spines, and you go see the patients after, and they are so comfortable. And it's just this amazing anesthetic has been set up, and you know, we tailor to the patients, of course, as needed. It's not like a total rigid protocol, but it gives this sort of framework for how to take care of these patients, and they are so happy and comfortable afterwards. It's just very, very satisfying.
How do you manage work-life balance?
I'm kind of one of the employees, not one of the partners, so I don't take call. And the nice thing is that they have this opportunity to do one or the other, depending on what your focus is. And I have 2 small children, and a husband who works also full-time. And so I work 4 days a week. I work Monday, Tuesday, Thursday, and Friday. And if for some reason I need to switch my day off from Wednesday to another day, you know, they've been very accommodating. They really do want to make sure that we're all happy, we're all taken care of, we're all getting what we need in our personal lives. I recently actually had to switch a whole entire vacation week, and it was kind of last minute, and it was, you know, not an issue at all, and they were very supportive. It was for a medical issue for one of my family members, and they were, you know, nice and supportive, and everything is fine, but it was nice to know that I didn't have to worry about work, that I could focus on my family member, and they were able to switch my time off. It was no issue, and when I came back, they said, "Oh, it all sounds like, you know, maybe you need a vacation for yourself, you know, you break from, you know." So they recognize, and they're nice about everything.
That's great. So you can really like leave work at work.
And yeah, I can, and that's the nice thing too about. But on the flip side, I can leave work at work, and I'm happy to, but if I'm doing something, for example, yesterday I was taking care of a patient who was a friend of somebody on staff, and then it was like, would have been time that I could have gone home, but I don't want to like just leave to go home. And so, you know, I'm stay to finish taking care of this patient beyond when I need to. And they said, you know, you're totally free to go home if you'd like to leave. And I said, no, I'm going to stay and finish. And when it's that back and forth, you know, they're good to me. Not that I'm being good to them by saying to take care of this patient. I wanted to, but it's not like, oh, I'm trying to rush out at whatever time I leave. And if I ever need to leave, I can. And I don't feel like necessarily even a desire to run out the door at whatever my end time is every day. I'm happy to stay. I really enjoy being here, the people I work with, the work that I do. But then, yes, when things are happening at home and I'm there, it's nice. I you know, we don't have any obligations once we're at home.
What keeps you motivated at work?
I think the desire by everybody to provide excellent patient care and just do it as a team. That if there's support needed, another pair of hands, it's everybody works together, but also provides excellent patient care. You know, I mean, I've seen a lot of settings, and it's not always the case that you have 2 people saying like, oh, do you want a hand, you know, getting this started? I'll come and, you know, it would just be an extra pair of hands while, you know, you're putting in an A-line, you're flipping, you're doing the ESP blocks. Like, you don't need to do it all by yourself. And normally I do, and it's fine to do it, but it's also just if somebody's there offering, it's nice.
How has the adjustment been as a relatively new member?
I've only been here since May, and it's now, what are we, March. So 9 months or so, not even quite a year. But I feel very much part of the family. It doesn't take that long. And it's, a relatively large enough group, but I feel like I know everybody and everybody knows me. And it's been a very smooth and easy transition getting started here.
What leadership opportunities are available?
Well, I think there's leadership opportunities for anybody who wants to get involved. They are very supportive of people kind of fostering that leadership in their career. Right now, just in the initial, I've been on like the receiving end of learning a lot of this regional anesthesia, which has been excellent. And as I come on staff with this new regional fellowship, I'm just really excited about doing that too.